Hi, everyone. It's Dr. Paul from EOHU Health Unit, once again with a weekly COVID-19 update. As usual, I'm going to go through some of the data. I'm going to just share the screen right now to show you that, again, our hospitalizations are 10 and 1 ICU right now, but they're steadily going down, and all the other indicators are going down as well. So I'm going to go through them one by one. If we're looking now at our hospitalizations, and this is total hospitalizations for all our population, including hospitalized in Ottawa as well. And we can see that this is cases who tested positive, not necessarily admitted, and again, for COVID, but again, you could see those numbers peaked, a while back ago, and then now are going down. So that, which is good. And about 40% of the patients that are in hospital who tested positive are in for actually COVID. The remainder happen to test positive, but are not in for COVID symptoms. This is a more accurate description of COVID-related admissions and in our 4 local hospitals where we get the data from. And you could see that we've got right now 10, but you could see kind of the upward tick here in April, and then kind of stabilizing. So I'm happy that it's going down, but we still have 10 hospitalized, including 1 in the ICU. If we're looking at our positivity, this is a good news story. We're really going down. You can see we peaked quite high, 20% here in April. We were actually quite higher in certain postal code areas, but then you can see we're going down. We flattened a bit here, but now we're down to 9.3%. It's been a while. We haven't been that low, and really I'm hoping that we can go even lower. So that's a good sign. If you're looking at the trends of our outbreaks, and this is outbreaks in our institutions, which include long-term care, retirement homes, and hospitals. Again, you could see that we peaked in April and then going down a downward trend. And again, these take a couple of weeks to clear, so we are going in the right direction when it comes to that. When looking at wastewater, as you know, we measure wastewater in Hawkesbury, Cornwall, and in Castleman. And by the way, we are working on getting Morrisburg water tested as well. We're working with the University Queen's and the ministry and the local municipality to get that arranged. But for now, we've got 3 that we're testing, and you can see that in Hawkesbury and in Cornwall and in Castleman, there is a definite decrease, as we can see, in flattening of that. We also see the same provincially, and I'll show you that later. And speaking provincially, all of the metrics, all of the things that we look at in terms of cases, deaths, positivity, and so on are really on the way down. And that's good news, including hospitalizations and ICU admissions across the province. The outbreaks are just up a bit, but they're kind of stabilized. It's a 3% increase. Everything else is down, 30% down in cases, 35% decrease in deaths, 20% decrease in positivity. So that's good news. And again, provincially, we are seeing, and this is the wastewater measure, we're seeing again across the province and in our area to eastern here, which is anything east of Belleville, a trend downwards and a provincial trend downwards. So again, we're seeing again that we're on the other side of the curve, really on the way down, and that's good news. We're seeing provincially as well. I told you that we're about 9% positivity in our area. You can also see that we're averaging about 10% in the province, but you can see that it's going down as well compared to what we had in April. If we're looking at health units now, this graph actually shows for the first time in a while that all health units across Ontario are experiencing decreases in weekly cases, and that's good. And you can see us here, we're among the lowest now in terms of rates in the province, which is again good news. If we're looking at sort of the picture across the province in terms of geographic, again, you could see that there's a variability across in terms of cases per 100,000 population, but you see we're among the lowest in the area. Kingston is a bit higher, Leeds Grenville is higher now. We're almost like the same as Ottawa here. So again, there's variety across the province, but the trends are downwards across the board, literally. And if you're looking at, again, this curve here shows us, this is the wave that we had, the previous wave we had last year, and then looking at sort of last fall, and then looking upwards, you could see here that the cases are actually going down. Blue is the cases. Orange is the hospitalizations, and red is the ICU. And you could see that really, this time around we had almost lower admissions than the previous certainly previous waves, certainly much lower than the wave 5 that we had in January, and certainly the hospitalizations were lower, as were the ICU admissions, which is good news. And I'll show you a bit of a graphic as my last slide as to why that happens and how that happened in relation to vaccinations and other things that have occurred over the last 6 months. Speaking of vaccinations, we're now, again, we're looking at our levels, and we're about, again, 88, a high percentage of our population, 5+ is first and second dose vaccinated. If you look at 12+, it's the 90s, which is good news. We're now up to 57% of the population that's third dose vaccinated, and 26% of all 60+ are vaccinated in total. Again, we need that number to go up, and as I'll show you in the next slide, it's higher among the elderly, which is what we want. But we can also see these curves here that give you kind of a trajectory. This dotted orange line here is our positivity, and this line is our cases. And again, you can see that we're on a downward trend, and this is specific for our health unit. The next slide here just shows you age groups. And again, we're almost 50% of 80 plus that have received their fourth dose, 31% 70 to 79 fourth dose, and 14% 60 to 69. So we need to get these numbers up, fourth dose to provide the optimal protection. And you can see that in terms of the green third dose, we're pretty good, 60 and above, we're above 80. However, we have work to do. We need to get those numbers up in the 80s across all age groups, including 12 to 17, which is quite low. And the reason for that, as I've said it time and time again, is that when we provide third dose, we know that it gives you much better protection than second dose against hospitalization and severe disease, and the effect lasts longer. And so that's a good news. That's one of the good reasons we need to do that. The other reason is, as you can see here, and I show that again, is that we know that with Omicron, and I'll explain a bit later, with Omicron, unfortunately, the vaccines don't prevent infection as much as we'd like them to. They do prevent hospitalization and admissions, and that's why we've been seeing lower numbers, and the number, particularly with this outbreak that we've had now with the wave 6. But but in addition to preventing hospitalizations more, the third and lasting longer, the third dose, actually, if you get infected and you've had a third dose, you're much less contagious than if you had a second dose. So for community transmission, it is also good that the more people that are third dose vaccinated, at least, they shed the virus less if they get a breakthrough infection. And again, that's what I wanted to sort of explain to people, that yes, there are benefits, multiple benefits to getting third dose vaccinated. And I'll finish with this slide here. I'll spend some time on it because I think it's very important. I want to share with you what's happened for the last year and a half now, and the different milestones that have occurred in Ontario, in Canada as well, but specifically, in Ontario, just to show you the relationship between things. So we can see here, this is last January, going into January. We had a wave at that time, if you recall, and then we had a sort of a second wave that started, around March last year. And it coincided at that time with the Delta being predominant strain. And at that time, the vaccine worked very well against Delta, not only in preventing hospitalizations, but also in preventing infections, okay? And that's important. And so we started the vaccine rollout over the summer, and you can see here, Delta was predominant, and so the vaccine not only prevented hospitalizations but also prevented the cases. And you could see that we really didn't have a big wave here in the fall. And things were going well. The vaccine then started to wane a bit in terms of, it didn't. We thought that we'd need some boosters eventually, but then what happened was all of a sudden Omicron appears, and although it was less severe than Delta, it actually was much more easily transmissible and less responsive to a vaccine, the same vaccine that we had, to the COVID vaccine, for the infection itself. So the vaccine prevented hospitalization, but did not prevent people from getting it. And most people that got it were mild. So that's what happened here. And so all of a sudden, it's not the vaccines didn't work or the vaccines were not effective. It's just that the Omicron became resistant to this vaccine that was made predominantly for the Delta variant. And so what we ended up seeing is, boom, all of a sudden we had the huge wave here with millions of people being infected with Omicron, albeit much less people per cases hospitalized and less death and so on. But we had a lot of people at that point. It overwhelmed our testing system and so on. We had 4,000 admissions to hospital. But again, and we had deaths as well, but not because it was more severe, because it was just so many more people got infected. And that's about the time that so the millions infected here, and that's about the time that we started our boosters. We started our fourth boosters in long-term care facilities, and we started our boosters in the community as well. And you could see that the combination of millions being infected and the boosters as well brought us into the next wave, which is the current wave that we're at on our way out, wave 6, but much less cases, much less hospitalization, much less ICU admissions. And that's important. And so if we want to continue, what we want to do is, and then now we've added antivirals. So I'll talk a bit about that in a minute. But what I wanted to tell people is that, you see, what we want to do is we want to end up as low as possible, going into, they want this curve to go down as low as possible. You see here, it's quite low. I call that baseline. We need that baseline to be as low as possible going into the fall, because we do know that there might be new variants and closing doors and all that, going indoors might cause us to, get a surge of COVID and other respiratory illnesses and so on. So I would like to see as low as possible. And how can we do that? Well, first of all, number one, millions of people are infected, and that gives them a bit of immunity for a couple of months. However, if you got infected and it's past 3 months, you should get your next dose. We're continuing with our boosters. That's why it's important for that third booster. If that third booster, we need about 45% of our population to go and get their third booster, because that's going to bring this down as much as possible in combination with people that already got infected. So that's a combined immunity, both induced by natural infection and the boosters. And again, moving forward, we also have the antivirals for elderly and other people whose the vaccine doesn't work in because their immune system doesn't work. Well, we have antiviral medications that will then be able to fend off future admissions to hospital in severe disease. So it's very important that people understand, what happened when. Omicron has thrown a wrench into our plans, but the good news is that we were able to, decrease it, blunt it quite quickly, blunt it at a low level, and at the same time, we are looking at potential boosters for Omicron moving forward, and we have antivirals in that regard. So the bottom line is that we are in a better place right now. We're still not out of the woods. We have a pandemic worldwide. Those numbers are due to the fact that a lot of you have been vaccinated, which is great, and we're very grateful for that. Continue getting your boosters. Continue being careful. It's nice weather now, so outdoors will be much less dangerous, or much less of an opportunity for the virus to transmit itself. And if you're still in crowded indoor places, if you're uncomfortable, if you have underlying medical conditions, if you live with elderly seniors, those type of things, consider you should be wearing a mask, particularly if you're prolonged indoor contact. And moving forward, again, at least for the next couple of weeks, until we really get that transmission down, we're still at a 9% positivity rate. I would be happy if we're less than 3-4%. That would be a much lower transmission or the virus going around. So bottom line, thank you very much. Please continue getting vaccinated. Get your third, get your fourth dose. You can still get your first and second dose. We're also waiting for vaccines for the younger children as well. Likely we'll have some news over the next couple of weeks. But in the meantime, again, I just want people to understand, what we're doing. We have the tools in place. And I think the last graph really showed you, how the vaccines work, what has happened, and what we can do moving forward to make that baseline level of activity over the next couple of months as low as possible. Thanks again. I'll see you next week.